Suicide is an urgent public health concern. Globally, around 800,000 people die by suicide each year. In England and Wales, that figure is between 5,000 and 6,000. So there's a pressing need to reduce the mortality burden associated with suicidal behaviour. For more than 2 centuries, the dominant way of framing suicidality in the West has been as an individual mental health problem, and this has shaped the ways in which suicide is conceptualised in policy and responded to in practice. However, there's an increasing recognition of suicide as a social justice issue, often linked to societal conditions such as inequality, discrimination, oppression, and historical trauma. The international suicide research community has identified these issues as pivotal directions for future research. Current theories and approaches do not adequately address these factors. So by framing it through the lens of inequality and social justice, our cluster will contribute much needed, timely new insights and approaches to the issue of suicide and suicide prevention. So we propose 4 interdisciplinary projects. Interdisciplinarity combines 2 or more disciplines to a new level of integration in order to arrive at new approaches or solutions, or beginning to break boundaries. And this is what we want to do with our cluster. We've illustrated in this slide that each project is interdisciplinary. There are 7 different colours here to represent the 7 different disciplines or schools from across different faculties at the University of Hull. The Suicide and Media project will look at the relationship between media representations of suicide and their impact on public perception, attitudes, behaviour and prevention efforts. The Suicide and Addiction project will focus on the management of suicidal behaviour and alcohol use in care settings. Findings will be used to develop social justice informed tools to support healthcare practices. The Suicide and Domestic Abuse project will focus on intersectionality and examine the interplay between domestic abuse and suicide within the context of multiple disadvantages. And finally, the Suicide and Homeless project will draw on official statistics and ethnographic approaches to understand the intricate connections between suicide and homelessness to inform suicide prevention efforts. We aim to create a research environment that's sensitive to the needs of the people who are the focus of this research, and that promotes inclusivity and equality in all aspects of our work. So to do that, we will form an advisory group and a PPI group to engage stakeholders, services and people from marginalised groups to ensure that their voices and influence underpin our understanding of these communities. These are our people. Each research project has a supervisory team with specific disciplinary expertise. And so with the cluster, we hope to generate important developments in our understanding of suicidality and a unique community of researchers with the skill set to tackle local, national and global challenges in suicide prevention. So if you're interested in becoming part of an interdisciplinary team of researchers focusing on suicide prevention and social justice and a future career in this field, please get in touch. Thank you.